you and I were sitting across the coffee table from one another, and we were just in conversation, we were sipping our beverages and having a lovely conversation, we would be blinking 21 times a minute. Now, if you and I were looking at each other on a laptop, it would go down to 7 times a minute. And if I were staring at you on FaceTime on my phone, our blink rate would go down to 5 times a minute.
Welcome to Zestful Aging, the podcast where we celebrate aging with vibrance and we defy the stereotypes of what it means to age. I'm your host, Nicole Christina, a psychotherapist of more than 30 years, here to introduce you to my off-the-mainstream guests who will energize and inspire you. My hope is to create optimism about getting older and help you cultivate zest and joy in this season of your life. And I love to hear feedback from you, my listeners. Please drop me a line at zestfulaging@gmail.com. I read every single comment. And to find out more about this podcast, hop on over to zestfulaging.com. Well, I don't know about you, but I haven't thought much about my eye health for many years, and I've been pretty lucky that I haven't had many concerns, although I have started wearing eye protection for pickleball because I learned that you can suffer from a detached retina. So that's one way I've been a little bit more mindful about eye health, but as it turns out, eye health is the most overlooked pillar in wellness. Did you know it directly affects energy, focus, sleep, and even mood? And the way we use our screens today, all of the screens, the phones, the laptops, the tablets, all day long, our eyes are really taking a hit. And eye strain is something we cannot afford to ignore. So our guest today is Dr. Pam Theriault. She's a TEDx speaker and nationally recognized dry eye specialist. And she's going to give us some simple vision habits that can improve performance and long-term health. Welcome to the show.
Thanks so much for having me, Nicole. I'm so excited to be here.
Oh, good. Thank you. So I watched your TEDx and I was really touched by your story about how you came to want to be an eye doctor. Do you want to share that story?
Absolutely. So the story that I tell in the TEDx is a little bit later in my life, but the first pair of glasses that I received as a 12-year-old was when I decided I wanted to be an eye doctor. So we can probably all relate to the first time we ever went to the eye doctor. It wasn't my first round at the eye doctor, but at the age 12 was the first time I got glasses. And I can distinctly remember coming home from my appointment in my mom's Volvo and getting out of the car and looking across the street at my neighbor's yard and thinking to myself, oh my goodness, there are individual leaves on that tree. And I can see the clouds outlined in the sky, and everything was brighter. It was such a more vibrant world. And I thought to myself, wow, if I could do this every single day for others to see this way, what a wonderful way that would be to spend my lifetime.
They're transformative.
Right. And so from that day on, I wanted to be an eye doctor. If you ask me what I wanted to be, I want to be an eye doctor. I want to be an eye doctor.
Oh, I see. And was it a pretty straight course of education and training after that? Or was it sideways? Yeah.
No, from college to optometry school. I actually worked in the Department of Ophthalmology at a medical school when I was an undergrad. And so at the time I was kind of playing with, did I want to go to medical school and be an ophthalmologist or not? And I worked at an eye bank, which we don't need to get into, but that's for corneal transplants. It's very specialized surgery. And the people that I was surrounded by that did my same job when I was in college, they were in optometry school. And so a couple of them took me under their wing. They're like, you don't need to go to medical school. Optometrists are where the vision happens. So
I
went to optometry school and never looked back. It's just a wonderful profession.
Yeah, you talk about how when people say what sense they would least want to lose, it's sight.
Their sight, absolutely.
Yeah.
Vision is loss of vision is one of the biggest fears that we have in
Mm.
life right after death.
Mhm.
Loss of
Mm.
sight is the sense we don't want to lose.
Mhm.
And it's incredible to me at how much time we spend taking care of our teeth that could fall out tomorrow and we could replace them with,
Oh.
it wouldn't be easy to replace them, but we could absolutely replace our teeth. Yet we stand in front of the mirror and brush our teeth twice a day, every day, to prevent tooth loss. And not many of us are doing anything on a daily basis to take care of their
Mhm.
eyes.
That, I have to say, as someone who strives to be healthy, and I fancy myself someone who's up on these kind of health things. I have been absolutely right there with the people you're talking about. Now, is this made worse? Maybe this is the obvious question, but is this problem made worse by the fact that we are on screens all day?
Right. So absolutely the screen time plays a big role in it, and it's probably not for the reason that you think. So we can backtrack a little bit and go down the road of why screens are doing damage to our eyes. Are
I
you
would
ready?
love to hear. I want to hear all about it.
Okay. So it takes a little bit of anatomy, but not too much. So let's think about if you and I were sitting across the coffee table from one another, and we were just in conversation. We were sipping our beverages and having a lovely conversation across the table from one another. We would be blinking 21 times a minute. Now, if you and I were looking at each other on a laptop, it would go down to 7 times a minute. And if I were staring at you on FaceTime on my phone, our blink rate would go down to 5 times a minute. Now,
Mhm.
that's just average, but in general, we get a third as many blinks on our digital devices as we do if we were in conversation with one another, if we were involved in other tasks. And so when we think about our eyes blinking less, what does that mean to the front surface of our eyes? So the front surface of our eyes is a mucous membrane, and it needs to stay moist all day. And our lids, the act of blinking does two things. Number one, when the lids come together, there are oil glands that line the inside of the upper and lower lids. So when they come together, a little bit of oil is expressed and spread across the front surface of our eye. And that's the second thing that the lids do, is that it swipes the tears across the front surface of our eye and gives us a smooth layer of tears for us to see well. So, what happens as we're not blinking as regularly as we should be, in the moment, we might have some stinging and burning while we're on the computer or using our cell phones, especially towards the end of the day. Our eyes might just start to sting and burn. Our vision
Mhm.
might also start to fluctuate so that you're not seeing clearly and you've got to blink, blink, blink and get things back into focus. Does that ever happen to you after long
Uh,
hours?
yeah, I know. I try not to be on screens for certainly not like I think, you know, younger people. But I'm fascinated by this because I'm sure it's more than it should be.
Right?
So what I'm curious about the why we are not blinking while we are on a device.
Right. So that is the visual stimulus. Because our screens are brighter, and the objects that we're looking at, especially if we're scrolling on, say, our phone or going
Mhm.
back and forth from different websites, everything, especially on our phones, is designed to capture our attention. Those
Mhm.
advertisers, they want us to be looking at their information. The influencers want you to be watching their videos. And so
Mm.
everything is designed to hold your attention. That and in that way, you're not blinking as often. And it's not really how many hours you were on your phone or your screen yesterday. It's the fact that now we use these digital devices for multiple hours a day, 5 to 7 days a week for decades.
And so
That's
this
what's
is
going
not a
on.
blue light issue, or is it?
No, blue light does have another role that it plays, but the main issue with our eye health
Hmm.
and screens is this lack of blinking, this atrophy of the oil glands inside the lids because you're not blinking your lids as often as you should for decades.
Wow. And you're so let me this is going to be really simplistic, but let me see if I understand this. So the brain is saying, pay attention, pay attention, pay attention, and sort of overriding
The
your
blink.
okay, I see. Wow.
Yeah. If you've
That's
ever seen
something.
a kid on a playing a game, you know how they hold their eyes wide open and they're really
Oh.
excited and they're leaning in and it's that stimulus that's causing that.
Well, hi, Zesties. In addition to being a podcaster and psychotherapist, I'm an avid thrifter. And I think it's something you either love or you hate. I've always loved finding treasures, and it makes me happy to keep things out of the landfill. You may already know that fast fashion is a real scourge on the environment. And I have a few podcast episodes that explore this. One of my favorites is with Eric Minter, who's the world's authority on the secondhand market. His book, Secondhand, is really recommended. And here I'm digressing. The reality is that I love to thrift, but I also like to wear the same basic outfit. So I've started an account on eBay I wanted to tell you about. Here's a humble brag. I have an eye for quality pieces. Linen and cashmere are my favorites, and I'd love you to check it out. Go on eBay and type in Nikki's Thrifty, and it's NICKY apostrophe S, thrifty with a Y, and see what you think. I'd love your feedback. Why do you think that? Well, this is also a question that we could take us down a rabbit hole, but this is a bit obscure. Maybe
Hmm.
not in your world, but I have never heard this. I've heard of blue light. I've heard of other problems like sitting too long and all this stuff, but why don't we know more about this blinking issue?
Right. So the diagnostic tools that look at those oil glands in our lids have only been available for the past, let's say, 7 years.
Mm.
And you probably know a lot about the information that you read in a journal in order for that scientific
Mhm.
evidence to get into the clinic and become a mainstream part of an examination. It takes something like 15 years for it to become
Ah,
mainstream in clinical practice once the yeah, once the research is done. So it's not we learned this yesterday and now everybody's doing
okay.
it today. It takes a lot of time for it to really get into mainstream eye doctoring. But we've had the device to look at these glands in our lids probably in my clinic for 2019, so about 7 years.
Mhm.
And it's been a game changer knowing what these glands look like. So the day that we got it in my clinic, my technician and I sat down to learn how to take the images. And she took the images on my glands, and I am 51 years old. My glands are like you could open a textbook and look at my glands. And then we turned around and did my technician's glands so that I could learn how to do it. And she is 30 years old and hers looked like garbage,
Oh
right? Like they
my
were so
goodness.
atrophied.
So they're kind of dried up. Sort is
So
that?
they're atrophied. So they're shortened. The oil inside the glands thickens, and
Yes.
because we're not blinking as regularly as we should. And so as the oil thickens, it doesn't come out onto the eye as we're blinking. And then the gland goes, you didn't use that oil I made for you yesterday. So I'm not going to make any more oil today. And so you know how our
Oh,
bodies are. If we don't use
yes.
it, we lose it. So the glands actually atrophy over time.
Oh,
And that
goodness.
atrophying is very difficult uh, to retrieve again, to rehabilitate those glands. It can be done, but it's not easy to rehabilitate the glands
To
and get
wake
them
them up.
to.
Come
And
back.
so
Okay.
because that 20-year gap from my 50 years of age to her 30 years of age, it's the 30-year-olds in
Mm.
today that were born with a digital device in, maybe
In
not
their
at birth,
hands.
right?
Yes.
But it's that generation 30 and below,
Okay.
they haven't lived life without a digital device, whereas you and I know what it's like to go to the library and pull a book off the shelf and
I
do that
see.
kind of research, right?
Right, right, back in the dark ages. So, um, or do you recommend eye drops? What do you think about that?
So yes, so let's go back to that dental model I was telling you about. So
Okay.
we all know what to do to take care of our teeth, right? We teach our children from the age of 2, almost from the time that they can stand up. We put them in front of the bathroom mirror, we put them on their little stool, set them in front of the sink, and show little Johnny how to brush their teeth, right? And then
Mhm.
we have them do it multiple times a day, twice a day, keeps the dentist away, blah blah blah. So that hygiene keeps our gums healthy, keeps the bacteria off of our teeth, and we can use that same model of using just 4 products, so toothbrush, toothpaste, floss, and mouthwash, 4 products that we use for our teeth. We can use that same model and flip it to eye care.
Okay.
I call this 4 simple steps. And the first step would be an artificial tear. So, yes, would
Okay.
we use some lubricating drops throughout the day, especially if you're going to be on your digital device or your computer? Keep a bottle in your desk drawer or in your laptop bag, your purse, so that you can have them with you. And when you're on the computer for more than 2 hours at a stint, you're going to put the artificial tears in.
And artificial tears, is it a glycerin? What's in an artificial tear, I wonder?
So it's lubricating drops. Hypermethylcellulose is probably the most common ingredient, that's going to mimic the tears of the eye to
Mhm.
hold on to the front surface, to coat the eye, and give your eye that clear tear layer that light goes into before it goes into your eye, so that things come in so that your vision's as clear as possible.
Okay.
And then, so just lubricating, especially when you're on the computer, because you have your eyes open for longer periods of time, that helps to lubricate. The second step is really the most important step, and it directly relates to that dental model, in that we need to remove the biofilm. Just like we brush our teeth to scrub away the plaque, that's
Mhm.
bacteria that's living in our mouths that causes that bio layer on our gums and our teeth. We need to remove it every day. The same thing happens on our eyelids. So we have dirt, dust, debris, pollen, and bacteria that can gather on our lids and lashes, and that causes inflammation in the eye unless we remove it daily. So using a simple eyelid cleanser. Now, this is something that you can find in the eye care aisle. They've got pre-moistened wipes or sprays or foaming cleansers that you can use even just once a day. I usually recommend to do it at the end of the day, where you just scrub your lids and lashes to get that excess biofilm off of your lids.
That's fascinating. That is absolutely fascinating. I did an interview with a gentleman who talked about his journey with a glass eye, and talking about
Mhm.
how they have to get it polished because of this exact thing. It grows stuff.
Yes, the biofilm over it. Yes,
Mhm.
exactly. You have to remove the eye and cleanse it like you would your dentures. Or yeah, indeed.
Mhm. Okay. Now, if I didn't want to go and get an eyelid cleanser, Could I wash my face as I always do and use a washcloth and go over my eyelids, or is that not recommended?
That's not recommended because the skin of your lids is the most delicate skin on your face. So if you
Mm.
already have sensitive skin, then using something that used to be 20 years ago, we all said, oh, just use some baby shampoo. It's more mild, it's more gentle. But you don't actually want to strip the oils from your lids. That
Oh.
can cause more problems in the long run. So I do recommend you going and getting a special eyelid cleanser because they're
Mhm.
specifically formulated for that delicate area of your face.
Wow. Boy, am I learning a lot. Okay, that all sounds very reasonable. What is number 3?
Number three is a warm compress. Now, especially if you've been using the computer all day, this can be very soothing and very calming.
Mhm.
So that's using
Mm.
a microwavable or a plug-in warm compress mask, and you put it over your eyelids and close your eyes for about 10 minutes. That is going to heat up the oils that, as we were talking about, get
Mm.
trapped inside the lids and they thicken because we're not blinking regularly. It loosens the oils, it melts them so that once you remove that mask, you can blink your eyes a couple of times and get that oils moving again, and
Mhm.
get the oil to come out onto your lid. It can be very soothing as well.
Oh, it sounds delightful. Yes, okay, so we've got the compress, that sounds I think many people have these, microwave bags either with rice or whatever they have in them that could be utilized for that. And then, what's your last
The
simple step?
Yeah, the fourth simple step is to take a nutraceutical or vitamin supplement that's specifically formulated for the eyes. There's two of them. An omega-3 fatty acid supplement, you need about 2,000 milligrams. So
Okay.
doing that gives your body the building blocks for the oil in the oil glands. And so that one's very helpful. It's anti-inflammatory. It gives you a way to replenish that oil. Once you've gotten that clogged oil out, you can help your body make new oil to coat the front surface of your eye. And more recently, Bausch and Lomb, which is a big eye company, came
Mhm.
out with a different eye vitamin that helps make more healthy tears. So it helps make more of the watery portion of the tears. And both of these, are available over the counter. The Bausch& Lomb brand is called Blink NutriTear, or
Mhm.
I would recommend Nordic Naturals
Mhm.
omega-3 fatty acids if you want
Yes,
to get the omega-3s.
that's always highly, regarded. And so for people who are, we'll just say millennial, they're just on, gross exaggeration. Who knows if but it's everybody. But you see a lot of people. So interesting. I was at the US Open many years ago for tennis, and I just noticed everyone was looking at their phone, and I thought, why are we even here if you're if you're on your phone? It was
What are you
fascinating.
doing at a live event so
Yeah,
you can watch
yeah,
tennis?
exactly. So for people who do not know this and who do not blink enough, what is the result without help? The steps that you recommended.
So long term, those oil glands can atrophy, and as I was telling you, it's very difficult to revive them. There are ways in office procedures that we have to help re-stimulate those oil glands to help them grow and become healthy again. And the symptoms that patients will get, and I've had thousands of patients come through the clinic that their eyes sting and burn, their vision it fluctuates so much that by the end of the day they just close their eyes. They're like, I just have to go home. I just have to get into bed and just keep my eyes
Mhm.
closed. And it's really sad at what the decrease in productivity and even creativity. You can't focus on what you're doing if you're constantly sidetracked by your eyes not feeling well or not working well.
I see.
So
And is that what you mean when you talk about how eye care directly affects your mood and your focus?
Absolutely. There's a huge correlation between depression, anxiety, and dry eye disease. And it's kind of a vicious cycle. So when patients start to have dry eye disease, they can get very anxious because they don't know whether or not they're going to be able to finish their work projects on time. They're coming up on a
Mhm.
deadline. They don't know if they're going to be able to see well enough or complete the task. So they get anxious. And then they go to the doctor and they get anti-anxiety medication or
Oh.
antidepressive medication. And antidepressants and anti-anxiety medications decrease your tear production.
Oh my
They're one of
goodness.
those medicines that just decreases how much moisture you're making.
Wow.
Yeah, and it's just insane. So then it's this vicious cycle. I'm feeling anxious, and
Mhm.
then the medication, maybe takes care of their anxiety, but their dryness gets worse. And
Mhm.
so that's definitely a patient population that we really spend a lot more time trying to whittle down. If we take care of the dry eye, can you get off of some of this medication? Are
Mhm.
there any other therapies you could do that don't require medication to control your depression?
Mhm. Wow, it's so tangled up, right? I can see how it's like a puzzle for you. You have to kind of figure out,
Which came first?
yes, which came first. That's really interesting.
Yeah.
Any foods that you would like people to add to their diets to help tear production?
Absolutely. So anything that's considered anti-inflammatory. We can
Mhm.
talk about prebiotic foods, probiotic foods, and any omega-3 fatty acid rich foods like salmon,
Mhm.
mackerel, walnuts, shark. Unfortunately, most of us don't eat too much of that. But the,
Mhm.
the salmon, increasing walnuts, increasing those healthy fats, even decreasing, packaged goods that are high in
Mhm.
omega-6 fatty acids and
Mhm.
are so pro-inflammatory.
Mhm.
It's a really great way to decrease your dry eye disease. Dry eyes are correlated with inflammation, and so the more inflamed my patients are, so if I have rheumatoid arthritis patients, patients with
Mhm.
Sjogren's disease, lupus, these autoimmune diseases that are
Ah.
so much more prevalent in your patients and in mine, I'm sure,
Mhm.
because these at the age of 50, this uptick in autoimmune disease is just incredible here in the United States. So
Mhm.
decreasing systemic inflammation is
Mm.
huge.
Oh, and then we could have a whole conversation about trauma and, immune function, but that might be for another day. This is so helpful and makes so much sense, and it's so under the radar. I'm so glad we had a chance to talk about it, and it does sound like a lot of it goes back to just being more intentional about how our body works and what it needs to thrive and not just, kind of assume that it's gonna work for us if we don't treat it well.
Absolutely.
Yeah, yeah. Any role of exercise? Just curious.
So, exercise is great to keep your body healthy, and a healthy body will mean healthy eyes. So,
Mhm,
direct correlation, maybe not
mhm,
directly, but again, decreasing our inflammation. If
mhm,
we exercise more, we drink more water. Having a better hydration can help the eyes for
mm,
sure.
mhm,
Staying healthy and strong is super important.
mhm. Yeah, I can see that there's a lot of crossover with other systems, right, that love an anti-inflammatory diet. Yeah. So that is really interesting. Where can people find out more about you and your expertise and your work?
Absolutely. Well, I would like to encourage everyone to see their eye care professional every single year. If you don't
Mhm.
happen to live in Louisiana, then you're not going to come and see me, but see your eye care professional. There's so many things that can be done, and getting to know your risk factors for these conditions, having a good eye care check, if you're on your digital device, having a pair of glasses made specifically for your computer is super important. So see your eye care professional once a year. But if you'd like to learn more from me, I would really encourage you to download the digital eye strain guide that I built for my TEDx talk, which was all about 3 tips to preserve your vision when we're living in a screen-filled world. So I have a
Mhm.
downloadable handout that you can go through. You can set up your workstation. It talks about those 4 simple steps on how to care for your eyes. So if you didn't take notes during this podcast, you can check it out. And that's available on my website, which is pamterrio.com. And my last name is spelled The Riot. So Pam The Riot. RIOT.com and then /TEDx, and you can download
Okay.
that handout.
Do you also have a social media presence?
Absolutely. You can find
Mhm.
me on LinkedIn, Facebook, Instagram, and TikTok, and it's Pam Terrio or Pam.Terrio
Pam
on
dot.
those. On
Okay.
Instagram, there's a dot. I think on TikTok, there's a dot. The others are just Pam the Riot.
Great. Perfect. Well, I really appreciate your expertise, and I certainly will be doing some things differently now that I've learned about what my eyes need as we age too. So thank you so much for spending time with me today and sharing the good information.
Oh, you're very welcome. Thanks for having me on today, Nicole.
Thank you so much for joining us on Zestful Aging. If you like the podcast, please share it with some of your friends.
Our theme song is All I Did Was Wait for You by Kjartan Abel. Visit Kjartan-Abel, that's KJARTAN-Abel, ABEL.com to hear more of Kjartan's work. And our technical director is Stephen Litweiler.
And stay tuned next week for another interview with a fascinating and inspiring guest. See you then.